Welcome, everyone. My name is Erica Labb. I'm representing EPOCH Senior Living, and today we're having a great discussion with Dr. Nancy Berley. We're going to talk about Tembo. So let me introduce you before we get started. So Nancy K. Berley, MD, is the Associate Medical Director at Tembo Health, where she provides clinical and product development expertise for a telemedicine platform focused on improving health outcomes for seniors. And we specialize in seniors, with a special emphasis on those experiencing cognitive decline. With extensive telehealth experience, including previous role as core physician at 98.6 Incorporated, Dr. Berley is known for her compassionate approach to patient care. She spent many years in practice as a primary care physician specializing in family medicine. Dr. Berley earned her medical degree from Albert Einstein College of Medicine and completed her family medicine residency at UMass Chan Medical School. Welcome back, Dr. Berley. Great to have you here.
Thank you so much for having me back. It's great to be here.
It's wonderful to see you. And so Tembo and EPOCH Senior Living have a really unique and wonderful partnership. So we wanted to invite you back to introduce Tembo to those who are not knowledgeable of Tembo or want to learn more about Tembo. So can you give us a little introduction? Thank you.
Well, in my bio, I think you mentioned that we are a telemedicine company that focuses on senior care. So the majority of the visits that we do are virtual and video visits. And our goal is, like you said, to improve health outcomes in seniors. And so to do that, we have a few different services that we provide. In our senior living communities, we provide virtual urgent care with the goal of preventing unnecessary ER visits. Awesome. And we also have work with families of people with dementia, both in and out of senior living communities through a Medicare program called GUIDE.
Okay, fantastic.
Yeah.
So I'd love to talk about a couple of wow stories. We like to say epic wows. What is a wow story that you can share? And I've heard a couple, but I'd love to hear from you.
So while our goal is to avoid unnecessary ER visits, we also recognize that there are times when people need to go to the ER, and we can help by providing that additional clinical input and also creating a warm handoff to the emergency room. So in one case, there was a resident who was seen virtually by one of our physicians. I'll just back up and say that all of the urgent care physicians, except for me, are ER physicians. So they're all very well trained in this. They've all been doing this a long time, and they have a lot of experience also virtually.
And just to clarify, when you say virtual visit, we're talking about
on a video
screen.
On a video
so they
screen.
can see each other, even if it's 2 a.m.
Yep.
They see each other.
Exactly.
Wow.
And for people who have cognitive impairment or dementia, that is why the staff at these communities help them with the visit. So the staff are just as involved as the resident, and we also can call and have families join us.
That's amazing. So you always, particularly if people experiencing cognitive decline, have someone there that can share information.
Exactly.
That's amazing.
Exactly. Wow. Yeah. And we also have access to some of their medical information in our system as well.
Great.
So in this case, we had a very astute, very experienced physician who felt that this particular resident was experiencing the very beginnings of a stroke. So in addition to saying you've got to send them in through, call 911 and send them in, she reached out to the hospital and she spoke to them and let them know. So the stroke team met this resident at the door. Was able to assess them, agree that they were having a stroke, gave them the clot busting medication. There were no complications from the stroke. They recovered completely. And I want to say they were back at their community in like 24 hours.
I think I heard that too.
Yeah.
You gave me chills.
I know. It's amazing.
Because it could go so differently.
Yes.
Because you cut out all that time, the arrival, the wait, the triage.
Yep.
Then you say, oh, it might be a stroke. We're going to start treating. You cut all that time out.
Yep.
And
because you had a physician speaking to a physician saying, this is what I'm seeing and this is what I think is going on.
Unbelievable.
Now, we can't always prevent every wait in the ER, even if we call ahead. But in this case, it was really important.
That's amazing. Wow.
Yeah.
What a story. Okay. Yeah. One more story, ER related, and then we'll talk a little bit about how you help folks avoid the ER if that's what they want.
Or if that's what they want, or if we feel it's safe that they can do that.
Right, of course.
So another case, what happened was the resident was experiencing some significant abdominal symptoms, pain and other symptoms, and a different physician, equally astute and experienced, recognized this as kind of a real problem. Like, he was really worried about it. So he also sent them to the hospital, gave that sort of warm handoff. And it turned out that it was something called an intussusception, which is not a very common thing. It is when, if you imagine that the colon is almost like a telescope, so one part of it sort of telescoped or sort of folded back into the other part. Very painful. It is a medical emergency. He required surgery, but he had it and he was fine.
Wow. Okay.
Yeah.
Impressive.
So it's really, I think that getting the doctor, when we do our virtual visits, physicians are on that video within 7 minutes. Often it's even sooner. Often it's like 3 minutes. So you're cutting down a lot of time. These folks, these residents have primary care doctors, and by all means, the primary care doctors should continue to take care of them, as they can, day to day. Sometimes evenings, weekends, or sort of these emergency things. I was in a doctor's office. I remember when, someone would call and I say, I can't get them in. You have to send them to the ER.
Right.
And so this is a way to get a physician right on that video, seeing that person and speaking to the family, speaking to the staff, understanding this is not how they usually are, and really getting a sense of what's going on.
It's like, having been in this industry for a long time, it's pretty mind-blowing to think about just how that changes the care for the individual.
And this really came about because our CEO watched his grandfather, who was getting wonderful care in a senior living community, but have to go into the ER almost monthly for things that weren't truly emergencies. So the things we talked about are truly emergencies, but there are some times when it might not be something so emergent that it absolutely has to have the emergency room if we can get them safe care another way.
Okay.
Which we can.
Wow. Okay. So let's talk about that a little bit.
So I think one example where we see this is we can order mobile x-rays. And so we'll have people who have injured something and they'll get an x-ray. We can order an x-ray, or they've had a cough for a long time. Maybe they have a fever, and ordinarily you'd worry about pneumonia. Let's send them in. Well, we can order that mobile x-ray and get them treated. And then we've avoided a long wait in the ER. We've avoided possibly being exposed to other things.
Right.
We've also avoided, for people with cognitive impairment or dementia, that risk of increased confusion.
Right.
And we also know that people who have dementia have a higher risk of being admitted from the ER. So we may have even prevented a hospital stay, say for that person with pneumonia.
Right, which then exacerbates everything else going on for them. And I think when you're able to lay in your bed, and just get the x-ray.
Yeah, exactly.
And just be cared for, rather than like, your daughter's coming, she's going to take you, and we're like hoisting them up or whatever. It's just so much better. And even the drama sort of, and we love our first responders and are so grateful, but it's a lot when they come in, and especially for someone with cognitive, concerns. So that's unbelievable. And so EPOCH and Tembo have a great relationship. We're like so grateful for you. We're excited, and we want more people to know about just the service and service with us. And so how can people find out more about Tembo? So
certainly they can go to our website, which is tembo.health, because we also provide some dementia care that also shows up on our website. And so it can be a little confusing when you're thinking about looking about the urgent care. But if your loved one is living in an EPOCH community, then they can talk to, the wellness director or the executive director, and they'll be able to tell them about Tembo. And for anyone who lives in an EPOCH community, they have access to our urgent care. They are required to sign our consent, which is presented when people move in. But if they're there and the family wants a visit, or they have a consent already signed, they just call up Tembo. And there we are.
That's fantastic. So another amazing service at EPOCH Senior Living. Thanks to Tembo. It is great to partner with you. I'm Erica Labb with EPOCH Senior Living. Thank you, Nancy Berley, Dr. Nancy Berley, for being with me today. We appreciate you so much.
Thank you for having me.
Take care. Thanks.